In this section, we will be discussing best practices for remote monitoring. Best practices for remote monitoring include communication and collaboration, establishing standards and definitions, retaining flexibility, moving away from 100% source data verification, and remote source data verification. Let's delve into each one of these practices in more detail. For clear communication and effective collaboration, the monitor serves as the main line of communication between the sponsor and the principal investigator. Therefore, the monitor plays a key role as the primary contact person. Since more information can be shared more rapidly given new communication channels, the monitor must ensure that the correct information is received at the right place and processed appropriately between the trial site and sponsor. Another best practice for remote monitoring is to establish standards and definitions, which can be found in standard operating procedures or SOPs, existing or new templates, and other tools. Here are 5 things to consider when updating documentation for remote monitoring. Who will be accessing the documents? For example, is it all or specific members of the internal team? Or is it the external team members, such as monitors, auditors, or third parties? What types of documents will be accessed remotely? Research documentation can vary greatly from informed consent forms to calibration logs. Where will the documents be housed, and is it secure and 21 CFR Part 11 compliant? Examples of electronic storage include purpose-built e-regulatory or eTMF platforms, comprehensive document management systems, and shared drives. When will the documents be accessed and how often? For instance, during business hours, specific days or times of the week, following patient visits, and so forth. How will the documents be accessed? Access can include logging in via a secure organization VPN, permission-based control, via cloud-managed software, and more. Monitoring plans should also remain flexible to increase on-site monitoring in case of issues or problems. Flexibility in the extent and nature of monitoring is intended to allow varied approaches that improve the effectiveness and efficiency of monitoring. The sponsor may choose on-site monitoring, a combination of on-site and remote monitoring, or, where justified, remote monitoring. The rationale for the chosen monitoring strategy should be documented in the monitoring plan. All changes should also be documented. Monitoring has always been considered an important activity which has followed the tenet of 100% source data verification, or SDV. It has been hard to let go of the comfort feel of looking at all the data to catch mistakes. It has been largely believed that source data verification means better quality. Since current regulations do not speak explicitly and quantitatively about the nature and extent of monitoring activities, researchers and monitors tend to err on the side of caution. The International Council on Harmonization, or ICH, defines monitoring as the act of overseeing the progress of a clinical trial and of ensuring that it is conducted, recorded, and reported in accordance with the protocol, standard operating procedures, good clinical practice, and the applicable regulatory requirements within its efficacy or E6 guideline for good clinical practice. This definition does not mandate specifics of how much or how little monitoring is necessary to ensure quality, nor does it state how and when to conduct visits. More specifically, ICH E6 Section 5.18.3 states that the sponsor should ensure that trials are adequately monitored. The sponsor should determine the appropriate extent and nature of monitoring. The determination of the extent and nature of monitoring should be based on considerations such as the objective, purpose, design, complexity, blinding, size, and endpoints of the trial. In general, there is a need for on-site monitoring before, during, and after the trial. However, in exceptional circumstances, the sponsor may determine that central monitoring, in conjunction with procedures such as investigators' training and meetings and extensive written guidance, can assure appropriate conduct of the trial in accordance with GCP. Statistically controlled sampling may be an acceptable method for selecting the data to be verified. From this section, it is clear that ICH does not explicitly state the extent of monitoring necessary to ensure quality, nor the methods to do so, nor the timing of monitoring visits. Therefore, breaking from 100% source data verification is allowed. Instead, a risk-based monitoring approach should be implemented. This type of monitoring focuses on high-risk data points or data points which are prone to mistakes or differences in interpretation or transcription. These can have a high impact on the quality of the data and the outcome of the study. Remote risk-based monitoring is customized for each study and site, while continuing to implement methods and techniques to replace 100% source data verification. For more information on risk-based monitoring, check out the FDA's guidances, titled Oversight of Clinical Investigations, a Risk-Based Approach to Monitoring, and A Risk-Based Approach to Monitoring of Clinical Investigations, Questions and Answers. Now we will go over what remote source data verification entails. Currently, some trials rely on paper copies of trial files stored across several sites, sharing source documents through fax, email, cloud-based file share systems, flash drives, or by granting monitors direct access to their electronic medical records or EMRs. However, granting monitors direct access to EMRs is generally not recommended, as it can generate issues regarding HIPAA compliance, difficulty finding source data or documents relevant to the trial, and possibly violate the informed consent document. Document review through emails, file systems, and fax are also not recommended, as documents may lack proper encryption or a proper audit trail, or can get lost, be duplicated, or misdirected. Remote clinical trial monitoring will require some method to access documents for source data verification, review of the trial master file, and other monitoring activities. Types of technologies being used for remote clinical trial monitoring include electronic case report form, electronic investigator site file, electronic patient reported outcome, and electronic trial master file. While these technologies and their interfaces can vary among sites depending on which software is used, they typically contain the same elements to assist staff with document completeness, timeliness, and quality. A trial site may consider an electronic trial master file system-based approach that streamlines the remote monitoring process. These remote monitoring technologies allow users to directly and in real time interact with the eTMF, upload necessary documents more quickly, efficiently collaborate with other team members, and obey attributable, legible, contemporaneous, original, and accurate or ALCOA++ principles. Additionally, these systems are generally ICH, GCP, and HIPAA compliant, such as with 21 CFR Part 11, and ensure a secure monitoring experience. These software systems include features such as a landing page containing insights for a trial master file, a file navigation system for viewing, uploading, and downloading trial files, and a document viewer for editing and sharing trial files, such as informed consent forms, site staff qualification documents, and subject information.